If I've had back surgery, can I use VAX-D?
Although one of our physicians will evaluate you to see if you are a candidate for VAX-D therapy, clinical results have shown that VAX-D provides relief for almost all patients suffering from the common causes of low back pain. This includes patients who have had one or more previous back surgeries. Once again, these conditions include ruptured discs, degenerated disc, and sciatica and posterior facet syndrome. Most people with these problems experience relief of their pain and are able to return to a normal level of activity both at work and play, such as golf and tennis.
Will VAX-D help a slipped disc?
A herniated or ruptured disc is sometimes incorrectly referred to as a slipped disc. This makes it sound like the disc has slipped out of place and can possibly be manipulated back into its place by a doctor. The truth is, there is no such thing as a slipped disc. Discs can't slip because they're attached by connective tissue to the vertebrae above and below. Since a slipped disc is really a herniated disc, VAX-D therapy is very successful in treating the problem.
If I go on VAX-D, how many treatments will I need, and just how quickly can I expect to get better?
The number of treatment sessions required depends on the diagnosis and the overall severity of your condition. Treatments generally average between 15 and 20 sessions. Some difficult cases may require a few additional treatments. Relief from pain and other responses to treatment vary with the individual and their physiology. Most patients, however, will experience pain relief after the first few treatments.
Is VAX-D as effective as surgery?
In most cases, VAX-D therapy is much better than surgery. Why? First, studies show that VAX-D is successful in almost 8 out of 10 cases. On the other side, surgery has shown itself to be far less effective. VAX-D treats the underlying problems that cause low back pain. By creating negative intradiscal pressures and creating a vacuum-like force, the nucleus of the disc is allowed to retract, which in turn takes the pressure off the spinal nerves. Surgery physically alters the spine by removing all or part of the problematic disc. Although this removes the pressure on the nerve and may offer pain relief, the surgery tends to put more stress on the healthy disc above and below. This can lead to pain and problems in those adjacent discs over time.
Are there any reasons I can't go on VAX-D?
There are a few individuals that cannot take advantage of this treatment. Now, these people have conditions such as tumors, fractures, gross osteoporosis, or certain conditions that compromise the structural integrity of the spine. These conditions are present in a small percentage of the people with serious low back problems. If you don't have one of these conditions and are suffering from serious disc-related back, hip, or leg pain, you're more than likely a candidate for VAX-D.
VAX-D seems to work so well. Why haven't I heard more about it?
Although the VAX-D table is an FDA-approved medical device, and the therapy has worked on thousands of patients, including hockey superstar Mario Lemieux and world champion pole vaulter Earl Bell, VAX-D is too new to have become a household word. Many family doctors are unaware of VAX-D and its effective treatment of serious low back pain and its underlying symptoms. More and more physicians and healthcare providers are learning about VAX-D and the phenomenal results it has achieved in the various clinical studies that have been performed. This awareness of VAX-D therapy seems to increase every day, and we expect VAX-D to be the standard of care for low back pain in the not-too-distant future.
How is VAX-D different from traction?
Although traction stretches the lower back, it is incapable of decompressing the lumbar disc and spinal nerves. The VAX-D table, by way of its patented programmable logic control, does not trigger muscle spasm and therefore is able to reduce the pressure within the lumbar disc to previously unheard of levels.
VAX-D therapy is revolutionizing the treatment of herniated and degenerative discs. It doesn't just treat the symptoms. It treats the very causes of low back pain. End the pain. Call today and set up an appointment with one of our specialists.
And start living an active life again.
Good game, guy.
Thanks.
This program has been brought to you by the VAX-D Physicians Network. If you know a friend or relative who has a serious back problem, please share this video with them. Now, if you'd like to find out more about the specific back problem that's been affecting you, please continue to watch the next portion of this video. It covers specific areas such as degenerative disc disease, herniated discs, facet syndrome, sciatica, and spinal stenosis.